So a rhinoplasty is changing the shape of one's nose. And before we can even talk about the techniques employed in doing that, we have to make sure that both you and the surgeon have the same vision, have what I call the ideal result, that unified vision. If we don't know what it is that you want to achieve, then we can't really achieve that entirely. So the most important part of rhinoplasty is actually the consultation, where we'll sit down and we'll talk about exactly what it is that you want to achieve. This is facilitated as well by taking your photographs, sometimes 3D photographs, and manipulating them to show you the intended postoperative result. Once you have deemed that what's shown is appropriate, we'll then go ahead and go through the next stage, which is the prep. Now, the prep is a time when we dot the I's and cross the T's and make sure you're all set for the surgery. On surgery day, you'll come in completely relaxed because you've already done all the administrative details. You'll be escorted back into the procedure room where there's a board-certified anesthesiologist who sedates you, and then the operation ensues, painlessly, I promise. Incisions are made on the inside of the nose and sometimes through a small incision connecting both nostrils. And more or less, the skin is elevated off of the underlying bone and cartilage, and then the bone and cartilage is manipulated a number of ways by either sanding it down or shaving it down, or sometimes sewing structures together, sometimes dividing structures, sometimes putting structures one on top of the other. So a number of techniques are employed in order to give the shape underneath the skin the final shape, such that when the skin is put back down on top of it, it gives the result that was discussed in the consultation. A cast and a splint is placed on top of the nose, and 1 week later, the splint and the cast come off.